The results-driven Merrimack Valley Chamber of Commerce invites you to connect your business with 1,000 other companies just like yours, including education and workforce development, healthcare, professional services, manufacturing, retail, nonprofit, trades and vocations, hospitality, among many others, and benefit with chamber programs and services such as government affairs, energy and economic development, small business assistance, networking opportunities, women in business programs, young people in business programs, and more. We invite your business to become a starring member of the Merrimack Valley Chamber today and see what a difference this chamber will make for you. Join your community's most trusted, effective, and relevant business network connection today. The Merrimack Valley Chamber of Commerce.
Hello everyone, my name is Michael Bevilacqua and I'm the Vice President of the Merrimack Valley Chamber of Commerce. I'd like to welcome you all to another edition of the Merrimack Valley Chamber Means Business program. I'm here with a very special guest today, Steve Krekorian, who's the Director of Corporate Relations for Lawrence General Hospital. So welcome to the show, Steve.
Thank you for having me, Mike.
So Steve, I think everyone pretty much knows at least has heard of Lawrence General Hospital. They may have a family member themselves has been served at Lawrence General Hospital. But tell us a little bit about what Lawrence General Hospital is and why it's important to our community.
Sure. Thank you for this opportunity. I appreciate it. Lawrence General Hospital has been a vital member of the community for, well, it'll be 150 years.
Wow.
In 2 years, in 2025. So we are, at this point, one of the few independent hospitals left in Massachusetts.
Sure.
We serve not only the Lawrence community, but the greater Merrimack Valley community. We are the only level 3 trauma center in this area of the Merrimack Valley. And we provide critical emergency care to this community, as well as other full hospital services at Lawrence General Hospital. We have about 2,000 employees, and our community is one that's very diverse, as you know, in
Sure.
Lawrence. We had a lot of strains with the pandemic that we came through, but it was a struggle for us, and we had the highest COVID rate in the state, and the caregivers, the frontline folks at Lawrence General were there every day for the community, and we're hoping now that we're coming out of that we can get back a little bit more to normal operations.
Yeah, Steve, I want to commend you and Lawrence General Hospital staff because you mentioned the pandemic. When people were staying home from work, you were all going into work. You were dealing with people who had the COVID. And this was the highest risk part of the Merrimack Valley as well. You had to serve those people. You couldn't take a day off. You couldn't say, let me get back to it tomorrow. These were things you had to face head on without knowing what to do and how to do it, but you figured it out. And I just want to say thank you for being there for our community during that pandemic. And you know, you're a very well-respected hospital right here in the Merrimack Valley, right here in Lawrence. You serve local people, you hire local people, so you're very important to the community.
Thank you. I'll accept that appreciation on behalf of our frontline caregivers.
Yes.
And I think it's well to mention that. And not only that, but on a daily basis, those are the folks that provide the care. And as I'm relatively new at the hospital. I started in December, as you mentioned, as Director of Corporate Relations. And as I meet with our caregivers, both the leadership team and the individuals to provide the daily care, I come away with the commitment that these folks have to the community. They're at Lawrence General because they want to practice medicine.
Sure.
They want to provide direct patient care. I've had a number of folks say they came from a teaching hospital environment where they weren't able to provide the direct patient care.
Sure.
We're all about patient experience, and the folks that deliver those services to the community really stand behind those words, and so it's something that we really strive for. I think one of the things is I'm out talking to businesses to raise awareness of the hospital and frankly to generate support for the hospital as it relates to ways that folks can help the hospital, companies and individuals, both in terms of perhaps volunteering, but also very importantly from a financial standpoint to support the hospital. And so as I talk to businesses, I like to, and individuals, I like to make them aware of the fact that, you know, as you mentioned, Michael, it is a critical part to the community. And for any of us that live or work in this area from the Merrimack Valley, if we have a company and we have employees and there's an issue at work, they're coming to Lawrence General. If we as residents of the Merrimack Valley have an emergency issue, we're coming to Lawrence General Hospital regardless of
Sure.
other healthcare choices that we make. With 2,000 employees, in addition to the healthcare impact that we have in the community, we have a significant economic impact on the Merrimack Valley. With 2,000 employees that live here, buy homes, if you're a local insurance agent, they buy insurance to cover their homes and their auto and
shop at the go to the restaurants.
Local restaurants, and the effect that we have on the local supply chain as it relates to procurement.
Get this supplies, all trickles down, all from 2,000 people right here in the Merrimack Valley in Lawrence, working at Lawrence General Hospital. And your staff is truly committed to serving this community, from the doctors to the surgeons to the nurses and the entire staff. You don't just view your patients as a number. You truly care about them. I've seen that firsthand. I know I have family members and friends who have seen that firsthand. And Steve, I know one of the reasons you chose to start working at Lawrence General Hospital is because you had that firsthand experience of why Lawrence General Hospital is so important yourself.
Sure. No, I'm happy to share that. I'm an Andover resident. My wife and I have raised 4 children in Andover, and I had, frankly, I guess fortunately, because we didn't have emergency room situations with 4 children, we had not had an experience with Lawrence General. And my oldest daughter, who I had mentioned to you earlier, just graduated from law school at Catholic University in D.C., has a vein issue in her leg that was treated by doctors at Mass General for years, relatively minor surgery. She had a more extensive procedure done in 2019, and due to some surgical complications on an emergency basis, we ended up at Lawrence General Hospital, and Lawrence General saved my daughter's life. Right from the paramedics showing up at our house and having to get involved on the ambulance ride to the hospital, with the hospital saving her and her recuperating for that day and then being transferred to Mass General Hospital. It really opened my eyes in terms of the level of care that Lawrence General provides for a small local hospital without a large teaching hospital partnership. It really is pretty amazing the services that hospital delivers. And my daughter was medevaced to Mass General Hospital, where she recuperated both in the ICU and the cardiac floors. And the number of doctors at Mass General that spoke to my wife and I and reached out to explain to us the quality of care and the decisions made at Lawrence, they were frankly extremely impressed, and that left an indelible impression on me. So as I looked, I've spent my whole career not in healthcare, but in business development and client relationships. And as I looked to do something a little bit different, one road led to another, and there was an opportunity for me to work with the hospital and to work with the business community. And so I'm not a caregiver, but I have that personal connection to the hospital that I hope serves me well and makes me work hard on behalf of the hospital, and that's why I'm there.
No, it truly is an amazing story of how it affected you and your family and why you're giving back to the hospital. You mentioned how, businesses can also give back to the hospital. How can the business community assist Lawrence General Hospital?
Yeah, no, thank you for mentioning that. We have formed a new business council. I'm happy to speak with anybody about it. I know your folks are going to be good enough to share my contact information. And it's a concept that's designed for small businesses, mid-sized businesses, large businesses. And the idea is we're creating a business council that's really much like a chamber of commerce within the hospital. Provide an opportunity for local businesses to meet with one another, to network with one another, to learn more about the hospital, and to provide insight, their professional insight to the hospital in any number of ways, and frankly to support the hospital on a financial basis. It's designed to be an annual membership program with various levels of support, ranging from levels of $500 to $1,000 to well above that. And with those different membership levels come various benefits in terms of lobby recognition in the hospital, website recognition, events at the hospital. And what we're trying to do is coalesce around that group to really form more of a cohesive business group. And I'm out talking to companies about that and presenting the concept and frankly getting ideas since it's a new thing for us. And so anybody that wants to reach out and discuss that with me, I'm happy to sit down and talk about it and would welcome that opportunity.
No, that's wonderful. It's great to hear that Lawrence General Hospital is able to involve the business community in this way. And I just want to say thank you for doing that as well. How do people find out more about this opportunity that you have?
Well, I think
we'll include the contact information.
Yeah,
on the screen,
I think frankly that's the best way to do it. I'd like to have where I can to meet with people in the Merrimack Valley. I'm a big believer in kind of face-to-face building relationships. But I'm happy for anybody to send me an email or to call me and to go through more of the details. But it's really not much more complicated than this group that will get folks together, organize around those membership levels, provide recognition for businesses as it relates to our website and social media and newspaper, and get them involved in the hospital in terms of invitations to local events. But the other part of it is we want to get some input from our new members to say, gee, maybe it's not as important for us. I've heard people say, well, it's not important for us to get together once a quarter.
So
maybe it's every.
You'll ask their feedback.
We want it to be collaborative.
Yeah.
Yes.
No, it's great because it's a great way to get the business community involved and also at the same time assist the hospital so they can do the great things that Lawrence Hospital does as well. So it seems like a great opportunity overall. You mentioned some of the things that Lawrence Hospital does, but what does Lawrence Hospital offer to the Merrimack Valley? What type of you can go there for surgeries? What else can you do at Lawrence Hospital?
Yeah,
or what would be the reason people go to it?
I think clearly on an emergency basis, that's no matter where anyone's healthcare, where their primary care doctors are, we serve the local community on a trauma basis. We're the only level 3 trauma center here in this area of the Merrimack Valley. So in life-saving situations, there's no better place for people to be. But also we do a lot of other work. Our cardiac programs are well recognized. We're a full-service hospital. A lot of work in the orthopedic space, the cardiac space. We have a state-of-the-art surgical center. And it's funny, as a new member of Lawrence General, it's interesting to me the way healthcare insurance is oriented now. My prior experience had been mostly Boston hospitals, but there is a financial incentive for someone like myself that's a hospital employee to look at the local network of doctors. And I've been doing that in Lawrence General, both as it relates to primary care doctors, specialty doctors, testing that needs to be done, related to physicals and whatnot. I'm transferring much of what I had done in Boston up here in the Merrimack Valley, and both because I believe in the hospital and from a financial incentive, it makes sense to do that. And so I'd encourage people to do what I've done. As I've become more familiar with the hospital, I've looked at different primary care doctors. I've looked at different specialists and say, gee, why can't I do that in Lawrence? And I think, to your point, a lot of it, in my own case, it's about education. It's about people realizing that those services are available.
Yeah, it's just creating that awareness, letting people know it's available, and letting them know how easy it is to take advantage of that. One thing we mentioned earlier as well is how involved Lawrence General Hospital is in this community, how much you're involved in Lawrence, how much you're involved in the Merrimack Valley. And you mentioned you have 2,000 people that you employ at Lawrence General Hospital. I think that's amazing because, as you mentioned, all the people that are affected by these 2,000 people being hired here at Lawrence General. Are these all local people that are hired to Lawrence General Hospital?
Sure. By and large, yes. Yeah. Although I will tell you, we have folks that travel a little bit to get to us. A number of our medical staff have lengthened their commute to an hour or so because they said, I no longer want to be affiliated with a teaching hospital, fine as they are. But again, going back to the aspect of direct patient care.
Sure.
So we have people that do travel and come to Lawrence General Hospital. I'm also told that in our emergency room, for example, we have a number of Massachusetts General Hospital physicians that on a per diem basis will work a couple of 3 days a month at the hospital to again, provide that direct patient care, and also I think to be on the front lines a little bit.
Sure.
The other thing I would mention, if I could, is that we're in an area that we have a very generous community, and a lot of nonprofits in the Merrimack Valley, Lawrence in particular, but across the Merrimack Valley. And there's frankly a competition for charitable dollars. And so one of the things that I like to mention to folks is the fact that, you know, we really are, as I mentioned, we're one of the few hospitals with and the only level 3 trauma center. And what would this community be without our hospital?
Sure.
And so as folks think about how to get involved and how to support various institutions, you know, I would just submit that there are obviously many fine charities, but there's only one Lawrence General Hospital.
Sure, that's a great way to put it. Steve, I just want to say thank you for being part of the show today. We're starting to close of the program. Anything else you'd like to add before we sign off today?
No, other than thank you very much for this opportunity. I've already taken advantage of the chamber, the events that you folks have.
Sure.
That has been a big help to me. And I would encourage people to reach out, whether you're a company, whether you're an individual, you think you can help the hospital out in any way, I'd love to talk to you and be happy to do so.
We'll make sure to include all your details on the screen so people can learn more, contact you, sit down with you, and learn more how they can assist, you know, this great hospital as well. So Steve, I just want to say thank you again for being part of the show today, and thank you for all you do.
Thank you very much.
Yes.
All right.
Thank you again, Steve.
All right.
And thank you all for joining another edition of the Merrimack Valley Chamber Means Business program. We look forward to seeing you next time. Thank you.